like to ride horses. I like to swim. I like to play the piano. I play the bass. I like drama. I'm in a drama club at school. And I like acting and painting, and I just like arts and stuff.
Hypophosphatasia, or HPP, is a rare condition that often weakens the skeletal system, potentially causing bone deformities, increasing the likelihood of fractures, and contributing to early tooth loss and pain. Morgan had not yet been born when she was diagnosed.
Because it's such a rare condition, before she was born, we were told basically to terminate the pregnancy because she was not going to have a quality of life. Bedridden, never walk, possibly mentally challenged. So it was very difficult. It was devastating. You know, my husband and I had decided that we were going to continue with the pregnancy, and the more research that I did, the more I found the devastation that there was no treatment. There really wasn't anything we can do, and it was, you know, keep her comfortable. And she surprised us. You know, she never went in the NICU. She took a breath and has been thriving ever since.
The prevalence is somewhere around 1 in 100,000 to 1 in 300,000 people. So it's a rare condition. Clinically, you essentially have hypomineralization of your skeleton. You have soft bones, and also the facility to lose your teeth because there is no cementum that keeps the teeth anchored to the alveolar bone. All of this, we now know, is caused by elevated levels of one of the substrates of alkaline phosphatase, inorganic pyrophosphate. So in hypophosphatasia, accumulation of pyrophosphate prevents the normal calcification of these hard tissues. We tested the hypothesis that by modifying the recombinant enzyme to include a targeting motif that would bind to hydroxyapatite, to bone mineral, we could target the missing enzyme to those sites of calcification where it is needed to sink pyrophosphate concentrations. And that concept worked beautifully. Essentially, we were able to preserve the life of the mouse model of hypophosphatasia. This treatment has now been translated into clinical trials, and in 2015 it was approved for pediatric onset HPP. So we can now correct the skeletal and the dental defect in hypophosphatasia patients.
It's always going to be there. I have a rare disorder, and I think that it's just an everyday thing for me. Like every other regular kid probably has their everyday thing, then they can do like anything they want. But I have like my limits, and I know when I have to stop and take a break.
It still is very hard, and it's been quite a journey for Morgan. I mean, she clearly has been through so much in her short 13 years, but I know that from where we started to where we are now, I feel that the future is bright. It's not as devastating. There is a treatment, thanks to scientists like Dr. Millán.
It's a very special relationship that I have with Morgan because she was the first patient with HPP that I met. And in fact, Kate, Morgan's mother, called me up early on when she learned that we were doing experiment in mice. And I think she was about 2 years old when I met her. I could hold her in my arms then. I can no longer do so. It's also important, this personal connection with Morgan as well as other patients of HPP that I have, because they're telling me what is going on in their bodies with the treatment as they progress and what is not going well. And learning what is not working helps me generate new hypotheses that I can then go back to my mouse models and ask those questions experimentally in the lab.
Through partnerships and invaluable resources, SoftBones works with patients and families living with HPP.
It did become a search and rescue kind of thing, and then we found out that it was a Mennonite predominant disease, and then I found SoftBones.
So this is where the advocacy groups play a very important role. They have this ability to gather information because they link to patients, to their families, they link to physicians, they link to researchers, and they can pool all of those resources and make them available to the medical community as well as to the patients and their families.
I want to go to college, and I want to be a veterinarian and do animal medicine and small animals like dogs and cats and reptiles or something.
To learn more about HPP and to donate, visit softbones.org.